Hi everyone, I just wanted to share my story about my SVT and my ablation. I found myself a couple weeks before my scheduled ablation going on YouTube looking up videos to try to help relieve some of my anxiety of what I would be going through. And I think that the growing number of videos on the topic are there, but it's still far and few to find videos about SVT ablations. So I'm hoping that by sharing my story, I can help relieve some of your anxiety that you may be feeling prior to your ablation. My story is a bit more complicated because not only do I suffer from SVT, but I also have what's called POTS syndrome, which stands for postural orthostatic tachycardia syndrome. And pretty much that means every time I stand up from sitting, my heart rate will be a normal heart rate anywhere between 60 and 80. And when I stand up, when I was first diagnosed, my heart rate was actually going into the 160s. That's a different feeling and different symptoms from the SVT, and that's a relatively newer diagnosis from about 6 months ago, 5 or 6 months ago. I have had SVT since I was young. I think I had my first episode in middle school. Unfortunately, I was never able to get it properly diagnosed because it was never really caught on time. It never had a good reading or whatnot. And when I was little and I went to the cardiologist, all he said was to not take aspirin. And that's all I ever did. And in 2010, I went back to the cardiologist because I would have fainting and dizzy spells. And they did a tilt table test, and all he diagnosed me with was syncope, which is fainting, and sent me home. And they didn't do much. So when I was hospitalized in July for shortness of breath, that's when I saw a cardiologist and she diagnosed me with POTS. So when I was released from that hospitalization this last July, I was put on metoprolol 25 milligrams twice a day to control the tachycardia. And during that time, I was put on a 30-day at-home monitor. And I actually did have an episode of SVT. However, I was in the shower, so I jumped up and put the monitor on as fast as I could. Unfortunately, it was a short episode, so they weren't able to get a full reading, but they were able to see that I definitely did have SVT. About a month after that episode happened, I had probably the worst episode I've ever had, and I was actually working at the time. I waited 30 minutes and it wasn't going down. My heart rate was in the 180s, and we did have to end up calling 911 because I started to feel like I was going to pass out, really lightheaded and tingly in my hands and lips and arms. So I went to the hospital. By the time I got to the hospital, my heart rate had gone down into the 130s, but we did get really good readings. So when I followed up with my electrophysiologist, they decided at that time that it was probably time to move forward with the EP study and ablation, especially because I was having SVT episodes while on the metoprolol. So the beta blocker, metoprolol is a beta blocker that reduces your heart rate as well as your blood pressure, but I was taking it for my heart rate for the tachycardia, and I was still having SVT. So they wanted to do the ablation, so we did schedule it for November 21st, 2014, and it was 2 weeks ago yesterday from the day that I had my ablation, and as you can see, I'm doing pretty well. So just to tell you about the experience of that. I checked in the hospital in the morning, and when I went back to my room, the nurse came in and talked to me, and 2 anesthesia techs came in and put an IV in both inner elbows, and then they put an arterial line in my artery in my wrist, and I guess that's what they use to monitor your blood pressure in the surgery. So nothing was being fed in or out of that line, but that's how they were monitoring my blood pressure. And I have to say, I was so scared about this whole thing, for one, like terrified. And any type of needles or vaccines or any IVs scare me to death. I hate it. And to be perfectly honest, out of the whole procedure, the arterial line was probably the worst part of it all for me. They did numb it when they put it in my wrist, but taking it out because it's an artery, they have to push really hard to stop the bleeding. And it's been 2 weeks, and I still have bruising. It's probably hard to see, but that's where it went in, right here. But that's that. After that, I had to kind of hang out for a while because the surgery that my doctor was doing prior to me went a little longer than expected. They estimate each ablation to be about 3 hours, but it varies per case. It could go anywhere from 2 hours on to like 6 hours It just depends on what they find when they're in there. So I went back for my surgery at 2 p.m. and before they wheeled me back to the room, I said bye to my family, and the anesthesiologist came in to meet me and speak with me and talk to me about my medical history and medications and whatnot. And I was doing pretty good until he came back there, and that's when I kind of broke down and got teary-eyed about the whole thing because I was so scared. And right then and there, he asked if I wanted something for anxiety, and he put it in my IV line, and it really helped me relax. And they wheeled me back to the cath lab. When I was in the cath lab, they had to actually physically transfer me to the bed to the table because at that point I was a little loopy from the anti-anxiety medication. So they moved me with like a sheet over to the other table, and then they put probably at least 20 stickers all over my torso from here down to my stomach, and then the big shock pads that they put on you as precaution, they put some on my back and on my stomach and chest. And then my doctor came and said hi to me, and they put an oxygen mask over my face, and they said that the anesthesiologist told me I would start to feel sleepy, and the next thing I knew is I was waking up in recovery. So another big part about my ablation, though, is that I was so scared of being awake because the majority of the time they use what's called twilight sedation, and that just means that it sedates you enough to where you don't feel anything, and most people don't even remember anything, but you're still alert enough to talk to the doctors and communicate. The thought of that, even though they say that you don't remember it, just the thought of being awake absolutely terrified me. So I was actually fortunate enough where my anesthesiologist did use general anesthesia, and my cardiologist allowed it. The cardiologists don't like to use general anesthesia because when you're completely under, it's hard for them to get your heart into SVT. They need to trigger your heart into SVT to do the cardiac mapping to figure out which nerves exactly need to be burned or frozen or however they're ablating them. So my doctor, though, did say that I ended up being one of the easiest and worst cases that she had seen in months, because even though I was completely under, once they went up into my heart with the catheters, my heart rate jumped up in the 130s, and they actually had a hard time bringing my heart rate back down. And my blood pressure dropped as well. So it was kind of tricky for them. But they did find that I had 5 nerves in my upper heart that was kind of like a web of nerves in one area that they had to burn. And because they had to burn 5 nerves, I guess usually I think the average is just like 1 or 2 nerves. I have seen videos where people had like 8 or 10 nerves burned, but some people only have 1 burned. So I had 5, and because she had to burn so many in that area, my heart tissue did swell up pretty bad. She thinks she got everything, but we won't know 100% until the next few months, to make sure I don't have any episodes or see how I feel and whatnot. So anyways, after that, I woke up in recovery, and I was laying completely flat, and I was shivering. I was so cold. They covered me from head to toe in warm blankets, and they gave me ice chips because my throat was very sore from the tube that they put in my throat because they used general anesthesia. And the catheters were already out of my legs, and I was very happy for that. I don't know if it was because I was under general anesthesia. I was completely asleep when they did that part. But when they take the catheter out of your legs, out of your groin, it's much like how they did the artery in my wrist. They have to put a lot of pressure on it to stop the bleeding. And I was scared of that because it sounds painful. But I was completely asleep. So when I woke up, I was already bandaged. And then shortly after I woke up, they wheeled me back to my room before I was in prior to going into surgery. And my family was able to come back, and they let me elevate my head a little bit, and I was kind of in and out of it for a while. When you do use general anesthesia, it has more risks associated with it, and it takes longer for it to wear off out of your system. So the first time I got up to go to the bathroom, the nurse had to physically lift my legs out of the bed. I think it was partly because of anesthesia and partly because I was sore. I did have to stay the night. The doctor came and saw me before she went home, and the first thing she said to me that all the doctors that ever told me I had anxiety were wrong and that I should feel much better now. The nurses that took care of me that night were so nice. They came in and checked on me throughout the night. They helped me walk to the bathroom anytime I needed to go. And anytime I asked for pain medication or nausea medication, they gave it to me whenever I needed. I went home at 9 a.m. the next morning, and I pretty much just laid on the couch for a few days and didn't do much of anything. 2 days after I got home, I started to feel a very strong burning in my chest, and that scared me. I thought like something was wrong. I called my doctor, and she said it's common, especially because of how many nerves they burned. It was inflamed. She did order or prescribe a high dose of anti-acid reliever medication and had me on high doses of ibuprofen for 3 days, and that worked. I feel fine. I haven't had any more burning. I haven't had any major fluttering or palpitations like a lot of people I've seen on YouTube complain about. Every once in a while, I might feel almost like a skip beat or like a strong heartbeat, but it's nothing for me to worry about or think twice about. Other than that, I feel pretty good. I feel my chest feels good. Because I also have the POTS syndrome, it's a little complicated because when I'm up and walking around, my heart rate is still going up into the 120s. But it's definitely not going up into the 160s like it was prior to me having the ablation and prior to me being on the metoprolol. The fact that it's only going in the 120s and I'm not on the metoprolol right now, that's great for me. I don't know for sure if I will have to go back on the metoprolol. I'm hoping I don't because the side effects of that I didn't like. It made me very tired all the time. So yeah, it's been 2 weeks and I'm doing good. I go back to work on Monday and I'm excited to really get back into the real life so that I can see how I feel. My main complaint with recovery was the walking. It took me almost a full 2 weeks before I could walk without limping. My groin was very sore. It wasn't like a terrible pain that I would need medication, but it hurt enough to where I was limping up until this last Wednesday. So it took me almost 2 weeks to walk normal. And that was my main complaint. Other than that, I feel really good. And so the only thing I have to say as far as advice goes is to try to not be afraid and just know that everyone involved in the surgery, from the doctor to the anesthesiologist to the anesthesia techs to the nurses to the x-ray techs, all of them are very highly trained, and this is what they do every single day. And from the moment I went in to the moment I was discharged, everyone was so nice to me. They cared for me. They had sympathy for what I was going through. And you could just tell they just knew what they were doing. Once you're finished with your ablation, you're going to look back and kind of laugh at yourself of how scared you were of the whole thing and how worried you were and how much anxiety you had. Because honestly, for me, I think about it and I'm like, it wasn't as bad as I was making it seem in my head because I was so scared to do it. And I just recommend that if it's something you're contemplating or if your doctor's been talking to you about or if you've been postponing it for a while, just be like me and just suck it up and get it over with, because I was one of the most scared people in the world probably to get this done. And I did it and I'm relieved and I'm glad that I did it. And just know that you're going to be okay. It's not as bad as you're making it seem in your head. So I hope this video helped you a little bit, and if you have any specific questions about the ablation process or procedure, please let me know. I also recommend to really voice your concerns with your anesthesiologist and your doctor, because they're the ones that have control over it. They're not just going to go in there and use, the sedation that you want unless you voice it. There's pros and cons to both. There's pros and cons to using general anesthesia, and there's risks with it, and there's pros and cons to using twilight sedation. I think twilight sedation would be perfectly fine. It was just, for me, it was just a fear that I had. It was a personal fear that I had about being awake. I'm glad that they did use general anesthesia. I wouldn't have changed that at all. But it really is a personal preference, and it depends on your cardiologist. So good luck, and I hope it goes well, and I know it will go well, and I know that you will feel better after you do it. So thanks for watching.